Let's get more insights from this from Dr. Lulu Bravo. She's Executive Director of the Philippine Foundation for Vaccination. Dr. Bravo, welcome to The Big Story.
Good evening, Robbie, and thank you very much for having me tonight.
Ma'am, as you know and as you heard from our earlier stories, other countries, richer countries, have moved on to booster shots. In the meantime, many countries, poorer countries, are still waiting to even get started or gain some momentum in their vaccination efforts. We are on that side of the fence as well. Other than expressing disappointment, as the WHO has said, what can we do? Or are we really just at the mercy of nations supplying these vaccines?
Robbie, you know what? We really need to educate not only our doctors, just like what we have done many, many years, before, but also our public, our layman, even our policy makers. This is very important. And I guess this is where the source of our confusion is all about. Because a lot of people really do not know what to do. And somehow they hear this news, they hear that news, and they think that, yes, this is all right for me. But what they don't know is that you need to be able to get recommendations from our own experts, our own FDA. I heard Dr. Eric Domingo a while ago saying what he needs to say to the public. And I do hope our policymakers especially would listen to the experts. Because it is not recommended. There's no booster yet that is to be recommended. There is no mix and matching that is to be recommended yet. And of course, only those who are allergic and those who had a first dose having anaphylaxis that needs to get a second kind of vaccine. Otherwise, we should not do this.
But there have been reports, of course, I'm sure you've heard of incidences of people taking it on their own, going for a second set of shots. Is it just a question of efficacy, or is it also a question of safety at this point?
Robbie, it is a question of insecurity because they cannot really remember, or this is something that only those who have studied and who have seen the effects of all these vaccines, those are the ones that we have to really consult. Those are the ones whom we need to ask for their recommendations, because we do have clinical trials for 220 years of vaccinology. Remember, 220 years. And the scientists have really gained a lot of knowledge about vaccines and what it can do to your body and what it does years and years and years after you are given a vaccine. And there are more than, right now, 30 vaccines that are now available to prevent diseases that are fatal, that are very severe, very serious. And the 30th vaccine is really the COVID-19. And I can tell you, it is a complicated matter. It cannot be just taken in as a social media information. We have to get experts' opinion. We have to get the clinical trial data analysis and see. And besides the clinical trial, of course, you also have to consider vaccine availability and the fact that we do need to listen to WHO. I was really, I would say, disappointed. And what Dr. Tedros said, seriously disappointed with some of our, well, I would say, of our leaders maybe, when they do something that is against the recommendation of our experts, of our scientists.
Okay, maraming salamat po. That was vaccine expert Dr. Lulu Bravo.